Deep within the wonders of the microscopic world lives one of the most dangerous predators, the lysovirus, or more commonly known as rabies, has wreaked havoc on humans and animals alike since it was first recorded 4,000 years ago by the laws of Eshuna. Every year, 40,000 to 7,000 people fall victim to this nearly 100% fatal virus, and while it's impossible to know the complete number of casualties over time, it's predicted to be in the millions. The lysovirus continues to affect civilization, never being fully eradicated due to the virus being constantly carried in the salivary glands of infected animals waiting for its next target. In this vast and unpredictable environment, we see the rabies virus in its natural habitat, the salivary glands of an infected dog. Bitten or scratched by an animal carrying the disease, it will enter the muscle cells through endocytosis after the virus connects to the cells in a lock and key fashion. From there, it will travel through the fibers until it can reach the neuron, where it starts going through the nervous system, killing nerves along its way, leaving its victims numb and in pain. This occurs because the rabies virus travels through the neuron/nerve cells to attack the brain, killing nerves in its wake. Its sleek, single-stranded, double envelope design allows it to move along with the nerve cells. A lipid bilayer protects the RNA enclosed inside that folds the genetic information of the virus for replication. The glycoprotein spike serves as receptors, allowing the virus to latch onto muscle cells. By this time, the animal will also start to behave strangely, and the virus starts to show itself aggressively, making the animal switch between depressed and excited states, while attacking other animals as well as biting its own limbs. In other cases, the animal will become extremely depressed and hide away. Additional side effects include nocturnal animals will come out in the daylight, losing their fear of humans and experience paralysis across their body. Once attached to the nerve cells, the virus travels up the spinal cord and into the brain, causing nerve damaging, resulting in numbing pain and tingles, and the patient displaying flu-like symptoms. Depending on the location of the infection, the types of rabies and the severity of the wound, and the quantity of the virus entering the body system, the symptoms will vary. What causes the symptoms is the rabies virus traveling to the spinal cord and the brain after entering the nerve cells. Once there, it replicates before spreading to the rest of the body. The early symptoms that are displayed are fever, tiredness, headaches, anxiety, or irritability. Following neurological symptoms depend on what type of rabies virus the host was infected with. If it was enterotic rabies, the more common of the two that is responsible for almost 80% of cases, the symptoms might include anxiety, seizures, confusion, hyperactivity, hallucinations, strange behavior, and general agitation, fear of water, hydrophobia, fear of fresh air, or drafts of air. The other main strain of rabies is paralytic rabies, which occurs in about 20% of patients. Symptoms of paralytic rabies include weakness and gradual paralysis, often starting near the wound site and progressively slowly. In both cases, the last side effect is death, with nearly all rabies cases ending with the patient passing away. On the odd chance that the infected do survive, they suffer lasting neurological effects. For example, in India, they documented 5 cases of encephalitic rabies infections. Subjects were a variety of ages between 3 and 25 years old, and it was a mix between male and female patients. Majority of the patients were children. Children are at a higher risk of infections as they might not recognize the warning signs given by animals, nor think of telling a trusted adult if they have any real-life contact with a wild animal. This is why adults must always be on high alert when they are with kids in a wild environment. In this particular instance, of the 5 infected, only 2 survived, but with poor cognitive function. At first, one of the surviving children deteriorated significantly after being discharged, suffering loss of speech, quadriplegia or tetraplegia, muscle weakness in all 4 limbs, and swallowing difficulties. Though 13 months past the manifestation, he was able to speak simple sentences, write, walk independently, but with poor balance, express needs, and obey verbal commands. The reason that rabies is so deadly is because the virus manages to restrain interferons and suppress other immune cell functions long enough until it can hide out in nerve cells. Regularly, when immune systems finds an antigen, the macrophage will consume it and display it on the outside. When the helper T cell binds to the macrophage and gets to divide, the T cells activate the B cells and produce primary T cells. Cytotoxin will bind to the infected cell and destroy it, but this only works for cell-mediated immunity. During humoral immunity, an antigen binds to the antibodies and they will divide and grow rapidly. Once the B cells are activated, they produce plasma memory B cells. Those plasma cells will work to release the antibodies, marking and destroying antigens. Thankfully, for the memory cells, when a virus re-enters the body, it will work 100 times faster and destroy the virus. But rabies is different. It moves slyly before the body. One of the most unnoticeable viruses is that it infects your body and is too late to treat by the time you notice it. This is because the rabies virus can move through nerve cells without triggering apoptosis and alerting its presence and allowing itself to stay hidden. First, everything is perfectly normal and still, but little do you know it is quietly working inside your body. This period is known as incubation period. This period is from the time of infection to the appearance of the first symptoms. During this phase, the rabies virus is slowly making its way into your brain to carry on the next phases. This period usually lasts for 9 days up to a year, but in cases it can be as little as 4 days and even up to 6 years. Then a shift occurs, also known as the primordial phase. This is when your body's defenses awaken and the symptoms start to show. As the immune system tries to fight back, it causes flu symptoms. However, the virus is moving through the nerve call. It might cause a tingling sensation which causes discomfort. This is a subtle sign that invaders are advancing. As 2, 3, 10 days pass, the illness can progress into a more serious stages, known as the symptomatic phase. At this point in time, treatment is extremely limited and possibly impossible to treat. This is also when rabies virus starts to kill or deactivate helper T cells, removing a crucial part of the immune system progress. This is why prevention is such as staying away from wild animals and seeking medical care after risky contact is so important.
Rabies can be prevented by getting vaccinated pre-exposure. The vaccine causes your body to produce antibodies when infected with the rabies virus. Children are at most risk of being infected. Keep them and yourself from the virus. Avoid touching sick or dead animals. Keep on the eye of children near animals, including avoiding and feeding strays. Routinely vaccinate pets and livestock with a pre-exposure rabies vaccine. Be aware of the risk rabies where you live and travel to, and being aware of what the symptoms of rabies looks like in an animal so you can report to the local public health unit or animal control. Besides children, many other groups are vulnerable to this deadly disease. People who are in proximity to infected animals are at a higher risk. Rescue workers, animal shelter workers, and people who are directly in contact with animals are more likely to get rabies. These are places in the world where there is limited treatment for this virus and where it is extremely widespread. So not only children, but even adults must be cautious about their surroundings all the time. In conclusion, it is important to be aware of what is around you. The only land safe from the list virus is Antarctica, as well as Australia. Despite that, all lands we inhabit have seen cases, some much worse than others. Over 150 countries worldwide, rabies is a serious health problem, killing thousands, with thousands more remaining undocumented. As said before, a majority of these cases come from stray or wild dogs, unfortunately, resulting in disease being most common in poor countries. Additionally, the world around us affects how the virus spreads with humidity and temperatures affecting how fast it moves. To prevent a wild animal bite from spreading rabies to humans and other animals, a preventative vaccine was made to kill the virus before it was able to get into the brain. The first vaccine for people was administered in 1885 to a young boy after he was bitten by a rabid dog 14 times. The creator of the vaccine, scientists Louis Pasteur and his collaborators Emile Roux and Joseph Grencher, had previously only used the vaccine on dogs, but Grencher convinced Pasteur to administer 12 doses of the vaccine to the boy, and the result was survival, marking the first ever use of a successful rabies vaccine on humans. Today, because the virus is not affected by vaccines, a 4-dose vaccine is given over the span of 14 days. In extreme cases, HRIG, or human rabies immune globulin, is injected around the area where the wound was. HRIG directly gives the body the most correct antibodies for rabies. Despite the vaccines, though, once a human host has started showing the effects of rabies, there is no proven method or cure. Though we know this much about rabies, there is still so much about this deadly virus waiting to be discovered. Despite how deadly the virus is, one can still admire the beautiful intricacies and technique that evolved over thousands of years of evolution. Perhaps in the future, discoveries will be made and the mysteries that shroud rabies will be uncovered, spurring further insights into the world of viruses and the natural world.